Okay, so today I'm going to go into the Medicare Advantage plans and the top three Medicare supplement plans, which are Plan G, Plan N, and Plan High Deductible G, as you see this HDG. So you might be thinking the thumbnail that you saw, what is this guy talking about? What is he getting into with this? I'm going to go over everything about Medicare Advantage plans and also about these three top plans. So basically, this video is going to be about 15 or 20 minutes long. But after this video, I'm almost positive that you're going to walk away knowing everything about these plans. And these are the plans that you want to look at. Now, if you don't know who I am, my name is Brian Monahan. I've been a licensed insurance agent for over 15 years, working with people that are going on to Medicare for the first time and that are also on Medicare for however many years. Now, these are the subjects that I want to talk about. Premiums, that is what you pay each month to the company when you buy the plans. Hospital coverage, doctor and outpatient centers and physical therapy coverage and so forth. CAT scans, skilled nursing, maximum out of pocket expense for the year, drug plans, and dental, vision, and hearing. Now I'm going to put maximum out of pocket. I'll just put for the year there. So let's jump right into it. Now, I did this with someone who is 65 years old. This is hypothetically, but this is going to be the premium and what they're going to pay if somebody's 65 years old. It does change with age for these three Medicare supplement plans, but with age, it does not change with the Medicare Advantage plan. So, the premiums. With Medicare Advantage plans, a lot of them now, they're PPO plans and HMO plans, and you'll see that there's zero premium plans, which means you pay the company nothing to get on the plan. So let's just say you got this Medicare Advantage plan. It's a zero premium, and you never went to the doctor or hospital. You threw it in your drawer. You're the healthiest guy in the world. This is all you would pay all year is zero. But I'll get into why that's most unlikely in a minute. Now, for the Plan G, keep in mind this is for someone who's 65 years old. These three plans, the prices do go up, usually every year, by a little bit, but for this, I'm doing someone who's 65 is going to pay $150 per month to the company. Now, this is an average. Now, don't just take this first column and say, oh, wow, this is zero, this one's 40. I'm going to get into why they're priced this way. So the Plan N, the average price of someone who's 65 years old is going to be $105, and for Plan High Deductible G, it's going to be $40. Now for hospital coverage, this is the real kicker. So for your Medicare Advantage plans, they usually entice you with this zero premium, and you see the commercials with the Part B give back and all the things that they're giving. But really, what I tell people is, you have to look at the premium, but you also have to look at what a hospital stay is going to be, what your maximum out of pocket per year is going to be, and then what these little things like CAT scans, MRIs, and doctor's visits, skilled nursing, etc. is going to be. So for this average of the Medicare Advantage for hospital, it's going to be $250 a day. The reason why, excuse me, the reason why I say average is because I saw plans that are $300 a day, $225, but we're just going to say $250. Now, a lot of these plans give out days 1 through 7 at $250 a day, and then it's zero after that. But if you take 250 and multiply that by 7, you get $1,750. So if you go to the hospital and you stay 7 days on some of these plans, you're going to pay $1,750. So keep that in mind. For the Plan G, you're going to spend nothing going to the hospital. You're going to pay $150 per month for the plan. When you go to the hospital, you can go in and out of the hospital. Any hospital that accepts Medicare, which is probably 95% of them, and you can go in and out as many times as you want, have surgeries, whatever, and you're going to pay nothing for that. Pretty good, right? For the Plan N, it's going to be the same thing. Zero for the hospital. Now, Plan N has a little bit things different. If you go to the emergency room, it's going to cost you $50 unless you're admitted into the hospital. So that's $50 possibly in the hospital, but for the most part, it's going to be zero when you are in the hospital. The high deductible plan G works a little bit different. The coverage is the same as the G. So you can say, oh, whatever the G plan does, the high deductible does the same thing, except for the fact, look at the premium. $150 for Medicare plan G, $40 a month for high deductible plan G. But the hospital coverage, I have zero down here, but really what this is the high deductible. $2,700 per year. I didn't want to put this on I can't put $2,700 everywhere. I'm going to confuse people. But $2,700 is what you're going to pay first. Then the plan swings over and actually acts better than a plan G because you'll pay nothing to go to the hospital, doctor, and so forth after that $2,700. So I'll get into a little bit further as we go along, but I'll get into that. So for CAT scans, I put this, I skipped doctor. So for doctor, Medicare Advantage, a lot of times they zero premium to go to your primary care physician. But a lot of these plans don't have referrals or anything like that, so it doesn't really matter. Most of the time you're going to a specialist. That's going to cost you $35 on the average. So you go to 10 specialists a year, that's $350. You go to 30, you go to 10, whatever it may be, this is what it's going to cost you. Now, for the plan G to go to the doctor, you have a $226 deductible with plan G, and that's with your Part B. Once you pay this $226 for the year, then doctor, hospital, outpatient center, physical therapist, and so on, CAT scans, MRIs, they're nothing, zero. So what you need to do with this plan G to figure out what you're going to pay for the year is $150 times 12 plus $226, and that is $2,026 for the year. And I'll get into a little bit more. You have to add your drugs and your dental and vision, but I'll get into that more. So really with plan G, your premium, you pay that 12 times a year each month. Then the $226 deductible, you'll pay that first, but that's only for the Part B with plan G. Once you're done with that, you pay nothing for doctor and hospital or physical therapist or outpatient centers or anything. Plan N works a little bit like plan G, but it's just a tad bit different. You pay your premium, $105, you pay this $226 deductible, and then everything is zero except for when you go to the doctor, outpatient center, and physical therapy, which is and other things, which is your Part B. So I usually just tell people, listen, with the plan N, you'll pay your premium, $105 times 12, plus the first $226, and then every time you go to the doctor, it's up to $20. It's the most simple way to give it to you. Now the plan high deductible G, you'll pay that $40, but then you have that $2,700 deductible that you have to meet first, whether it's the hospital, the doctor, and so forth, MRIs and all this stuff. And then you pay nothing out of pocket. So with the CAT scans, I put zero for these things. But like I said, with the high deductible plan G, you're going to pay that part of that deductible when you go. And then with the end plan, you're going to pay this $226 plus the $20 and then nothing. And then with the G plan, you're just paying that $226 and then you pay nothing. So I have zero for all those for CAT scans. Whoops. Skilled nursing, the big difference between the Medicare Advantage and these three plans. Skilled nursing, you get days 1 through 20 with the Medicare Advantage. A lot of them are free, not all of them. But or maybe it might be all of them, but it's 20 days. Then the skilled nursing for the medigap plans, the GN and high deductible G, you get the first 100 days for zero. So like I said, if you have the Part B, they're going to charge you this first $226 and so forth. But for the most part, it's zero for the skilled nursing for days 1 through 100. So you get an extra 80 days with any of these plans in skilled nursing. Now, the maximum out of pocket, this is the most important. And I hope I'm explaining all of these things correctly, because there's little details when I talk to somebody that I have to throw in there. But since this is a video, it would be an hour long if I had to throw in all these little details. So I'm trying not to do that, and I'm trying to keep it honest to where I'm telling you about all these little details. But the reason why I did a max out of pocket, that's because for the Advantage plans, there is a max out of pocket. A lot of these, if there's zero premium and they're a PPO or even an HMO, their max out of pocket is $7,550. Even if it's half that, $3,550. But a lot of them, the good ones that have large networks, would be this $7,550. So this is very scary to a lot of people. They do not want to pay this much. And think about it this way. Let's say you maxed out. You had major stuff going on one year at $7,550. The next January, you start all over with this deductible. So even if you paid $3,000 of this, you're going to start with another $3,000. And the kicker with the Medicare Advantage, this is just being honest, there are people who have said, oh, they didn't pay for this. I had to argue with the company, and I had to call the company, and they eventually paid for it, but I had to fill in these forms and all this different stuff. And a lot of times with the max out of pocket, also, if you have a PPO and you go outside of the network, the max out of pocket is now $10,000, not $7,550. For your Plan G, this is the cleanest plan you can talk about. This is what I said. When you have a medigap Plan G, you take $150 if that's your premium. You got it. If you're 70 years old or 75, it might be $250 a month, depending on what state you live in, if you're a male, if you're a female. See, this is personal, but on the average, it's $150. You take your $150 times 12, add your $226, and this is all you're going to pay for doctors and hospital and surgeries, physical therapy, everything. This is what you're going to pay, $2,226. A lot of people really like to know that number, because I wish I could pay this number for my health coverage. Like I said, you can go in and out of the hospital 100 times. You could have cancer and go through all treatments. You can have a heart attack, go have open heart surgery, all for this $2,026. Now, for the Plan N, the max out of pocket is going to be a little bit less than the Plan G. Why is that? Well, what I did was I took this 105, which is the average. I put the $226 deductible. Let's just say you're going to pay that. So 105 times 12 plus $226 plus $20 each time you go to the doctor. So I put that as 20 times going to the doctor, which equals $400, and it came to this amount. Now imagine if you used more. Even if you used more of this $20, or you went to the emergency room and that was $50, it's still going to be less, most likely, than the Plan G. So this is another great option. But I've had clients that complain about this, because it depends on how old they are, and they might be paying a high price for this, and then they have to pay $20 each time they go to the doctor. But if it's $105 when you're 65 years old, it's not, I don't know if anyone can get to $500 for the plan. And I'm sure there are people on there, they're probably 85 years old, but by that time you're using it so much that it's worth it, in my opinion, if you're paying that high. But this is what the max out of pocket for these two plans are. Now let's take a look at the high deductible Plan G. Now there's two reasons why I really like this plan. These two plans, the G and the N, I really like, period. Doesn't matter. I always tell people the G is the cleanest because you don't have any copays and so forth. You just have that one little deductible. That's what I would get if I was 65. But the N is also a fantastic plan. Now, there's two reasons why I tell people about the high deductible Plan G. The number one reason is, when someone's 65, I would never tell them to get on a Medicare Advantage plan. I don't care what their financials are, because I would think that they could pay $40 a month for their plan. If not, then most of the time they would probably be on Medicaid or something and not want to get this Medicare Advantage. But this is kind of in competition with the Medicare Advantage, in my opinion. $40 is not a lot for a premium, and the most that you're going to pay out of pocket is $3,180. That's the most. Most of the people that I have on this high deductible Plan G don't even come close to this, because they're not going to the hospital and doctor like crazy. or they're going a few times a year, whatever it may be. Maybe they never go to the hospital in that year and they save all of this money. I had one guy who basically paid his premium, went to the doctors a couple times. It was like $600 for the whole year. So that's one reason. But really, to counteract this Medicare Advantage, the second reason is when you get on one of these gap plans, or med subs as they call them. You know, this word medigap and Medicare supplement, gap plans, it's all interchangeable. They mean the same thing. When you get any of these plans, these are only the top 3, but if you get any of them, you can go to the Medicare Advantage for 1 year, try it out, and do a trial right and go back to the med sup. And I've had many people do this because they keep asking about this Med Advantage every single year. And I say, hey, why don't you take your trial right and check it out? And that's what they do. So, but you can't do that if you go automatically on the Medicare Advantage, because you can only do that once in your lifetime if you've never been on an Advantage plan. So that's another reason why, if people are like, I don't want to pay the money, I don't care what it is, I say, hey, you might want to try this plan. Very important. Now, here's the thing. With the Medicare Advantage plans, the commercials, everything, they attach a drug plan to that for zero cost, a lot of them. And they attach a dental, vision, and hearing plan. So people think, oh, this is great. Well, here's the kicker. So let's just say you get an Aetna Medicare Advantage plan. Then you have to get an Aetna drug plan and an Aetna dental, vision, and hearing plan. Same thing with AARP. You get an AARP Medicare Advantage, it'll attach their drug plan, AARP, and dental, vision, and hearing, AARP, or United Healthcare. But you can't mix and match. With these other plans, G and a high deductible G, you could have an Aetna plan G and get a Cigna drug plan and get a Humana dental, vision, and hearing. You get to choose from all these different companies. So here is a little story. I had someone call me who was on a Medicare Advantage plan. They said, listen, I only spent like $90 for the year for the not for the premium, but for going to the doctor a couple times. They said, but my drugs were $1,400 for the year. Well, that's because they couldn't mix and match with their drug plan. So that's very, very important. And on top of that, you can get these plans like I have here. These are averages. So let's say you only take 2 generics and you want this plan G or you want the plan N. There's a $6 drug plan out there, and the generics are probably either $0 or $2 or whatever they may be. So you're really not paying that much out of pocket for a drug plan with those generics. And the dental, vision, and hearing, I put the average of $40. Same thing. You could check out what your dentist accepts and get on one of those plans. That's, the mix and matching of the gap plans. So let me think for a second what I missed, because in some of my other videos, people left comments, hey, you left this out, you should have said this, or whatever it may be. But the bottom line is, people ask me, what would I get? What would I do? What do I think the best plan is? Should I get on a Medicare Advantage? And really with me, there's 2 things about Medicare Advantage that I would not get on those plans for. Number 1 is the max out of pocket. If you meet this, whatever you spend for the year, it's going to roll. January's going to come and you're going to spend it again, possibly, or even more. Who knows, even if it's less for that reason. And then on top of that, I have heard people say, oh, the plan didn't cover this, or I had to argue with the company. I can tell you right now with the plan G, or definitely the plan G, I'll say that. You pay this premium, you pay this $226, you will never call your agent and say, I can't stand this plan. Never. If this premium, if you don't mind paying that premium, no matter what it is, and look, I have $150 for someone who's 65. Someone who's 75 is probably paying $250 or the most $300. But here's the thing about these gap plans. What you do is every couple of years you change from one company to the next, and the plans are exactly the same. So what I do with my clients, I was going to pull up my spreadsheet of all my clients, but I don't know if I can do that without covering their names and so forth. And I can show you the prices. I have a lot of clients on G, and I'm talking about hundreds. A lot of clients on N. Not that many clients on high deductible G, but some clients like it, and it's very cheap. And some people are healthy and say, hey, I want to take a chance. I'm only going to pay $3,000 if I spend the most. It's only $1,000 a year more than the G. I'll take a chance with the high deductible. And that way you never get stuck on a Medicare Advantage. Now, here's another thing that people talk about. Can you go from a Medicare Advantage to a Med Sup? Some people you'll hear, you can't go back to a Med Sup. You can't go to a medigap plan once you're on a Medicare Advantage. Well, the reason why people talk like that so harshly is because if you go to a Medicare Advantage, except for that trial right, you have to go through underwriting to go on to a medigap plan, unless you're in your initial enrollment period, which means when you first go on. I have to mention that because the comments people will make. So let's just say you're making this decision when you're turning 65. Do you want to go on an Advantage plan or a gap plan? One of these three. I would always choose a gap plan because if you go on a Medicare Advantage plan, let's say you're on it for 6 months, and you don't like it because you had to go to the hospital or you had a surgery or you got cancer and they don't pay what you want, you're not going to be able to get into one of these plans because they do underwriting. They're going to ask you health questions. Have you ever had a heart attack? Have you ever had cancer? Have you had a stroke in the last 5 years? These are some of the questions they're going to ask. If they don't like the answers, they don't have to let you in. Once you're in a gap plan, you cannot get kicked out. If you get one of these plans, let's say you get on the N plan, you can change between N plans. You know what? Aetna's getting expensive. I'm going to Cigna. Or Cigna's getting expensive. I'm going to Aetna. You can keep doing that until a company doesn't accept you, and you can keep this cost low. But if you go to an Advantage plan, you might not be able to get back into the gap plan. You can always get into the Medicare Advantage. They don't have underwriting for these plans. So every year in October through December, you can get on one of these plans. So which would you rather? A plan that is hard to get into because the coverage is so great, or a plan that's easy to get into every year? So watch this decision with the Medicare Advantage plans. So thanks for watching this video. I think I went over everything. My opinion is I always tell people about G and N first. And I say, look, you're turning 65. Let me go over these. I tell them there's two avenues, Medicare Advantage and Med Sup. And then I go into the Advantage plans, what it is, and the Med Sup. And I basically go into this chart. And then after that, kind of work with them and make a decision. But most of my clients go with this G plan when they first turn 65. If not, they're going with this N plan. Please click on one of these videos, whether it's the playlist or it's another one of my videos. And in the description box below, there will be some other videos that you can click on and so forth. Thanks for watching the video, and I'll see you at the next one.